Turning now to America's labor crisis. As we all know, nearly every industry has dealt with staffing shortages since the start of the pandemic. But few shortages can mean the difference between life and death, but this one does. In tonight's Eye on America, CBS's Carter Evans studies what experts fear is a national health emergency.
Are you still 6 out of 10 pain?
Denise Farnsworth loves her job as an EMT.
It's what I live to do.
But after 7 years on the job, she can no longer afford to keep doing it.
What is your base hourly rate?
18?
$18 an hour?
Yes. To pay the bills, we have to work as much as we can.
Farnsworth actually makes slightly more than the national median wage for EMTs. The Bureau of Labor Statistics lists it as one of the lowest paying jobs in healthcare. That's the primary reason roughly a third of all EMTs quit in 2021. And the industry is having a hard time replacing them. A 2022 study found that 39% of part-time EMT and 55% of part-time paramedic positions went unfilled because of a lack of qualified candidates.
It's an absolute crisis. We have continual paramedics hitting the exit doors and leaving the field.
American Ambulance Association President Sean Bayard says Medicaid's reimbursement for non-emergency transports, like moving a patient between hospitals or taking someone to dialysis, keeps wages low.
It can mean the difference of having an ambulance or not having an ambulance.
AMR, the nation's largest private ambulance provider, is ending non-emergency transport in Los Angeles County. They cite low Medicaid reimbursement as a major reason for a $3.5 million budget deficit in that market alone.
It's unsustainable.
To keep from losing employees like Denise, their manager Brian Napoli says a raise is in the works, but the company can't afford it long term. And if Medicaid reimbursements don't increase, they may also have to stop non-emergency response.
How much does it cost you to make a run on average?
Over $250.
And how much do you get back?
$107 in the base rate.
A losing proposition. Next month, a California law goes into effect that can require a $22 an hour minimum wage for fast food workers. There is no mandated pay for EMTs.
Why is it that we can't get movement for the people that are serving our communities at their most vulnerable moments?
Leaving Denise Farnsworth at a crossroads.
I don't want to leave. I don't know what else I would want to do.
For Eye on America, Carter Evans, Los Angeles.